Healthy-ojas.com. Vital information for a healthier life.
Welcome to this video on symptoms of Covid-19, SARS CoV-2 virus infection. In this episode, I am going to discuss the following. What is Covid-19? Transmission of SARS CoV-2 virus. Parts of the respiratory system. What are the symptoms of Covid-19? Stage 1 infection with no or mild symptoms. Stage 2 infection with moderate symptoms. Stage 3 infection with severe symptoms. Why stage 3 infection develop complications? Why some individuals have a severe illness? Before going into the details, I request you to please subscribe to this channel by clicking the red subscribe button once and pressing the bell button next to the subscribe button. Okay, now let us enter into the topic. What is Covid-19? The SARS CoV-2 virus infection causes the disease Covid-19. CO from corona, VI from virus, D from disease, and 19 is from the year 2019. Transmission of SARS CoV-2 virus. The SARS CoV-2 virus infection spreads primarily from person to person through the droplets from the nose or mouth while cough, sneeze, or speak. People get infected if they breathe in these droplets from an infected person. The virus enters through the nose, eye, and or mouth, reaches the back of the throat to the lungs and or stomach, then to the intestine, liver, kidney, and blood, and might cause infection in multiple organs. Parts of the respiratory system. The respiratory system consists of the upper respiratory tract that include the nose or nostril, nasal cavity, mouth, throat, and voice box, and lower respiratory tract that include the windpipe and lungs. What are the symptoms of Covid-19? Based on the location of the infection, it develops a specific set of Covid-19 symptoms. There are 3 stages of disease. They are: Stage 1 infection with no or mild symptoms. The inhaled virus likely binds to epithelial cells in the nasal cavity and start replicating. In this stage, the infected person acts as a carrier and unknowingly can infect others. At this stage, usually there is no symptom or mild symptoms that begins gradually. Still, infected individuals is a carrier and transmit the virus. The most common mild symptoms of Covid-19 are nasal congestion, sore throat, conjunctivitis, dry cough, low-grade fever, tiredness, and drop in the sense of smell and taste. Most people, about 80% with above symptoms, may recover from the infection without any need for hospital treatment. Nasal congestion. Excess mucus secretion causes running nose and nasal congestion due to irritation or inflammation of the nasal tissue caused by coronavirus infection. Conjunctivitis. They are often called pink eye, which turns the eye into red colored due to infection. Conjunctivitis is an inflammation or swelling of the conjunctiva. It is a thin transparent layer of tissue lining the inner surface of the eyelid, covering the white part of the eye. Sore throat. Sore throat is a dry, painful, tickling, scratchy, and or irritation in the throat. Sore throat is due to inflammation by the virus infection in the throat. Dry cough. Coughing is due to a tickling sensation or mucus in the throat due to infection in the throat. Mostly, corona produces dry cough, that is, coughing without mucus. Repeated coughing can irritate and inflame the throat, so the coughing itself increases the irritation of the airway and leading to coughing more. Low-grade fever. A fever is when a person's body temperature is higher than normal, 98.6 degree Fahrenheit or 37 degrees Celsius. A fever is a result of the body's immune system trying to fight off an infection. Low-grade fever means when the body temperature becomes slightly elevated, usually between 100.5 degree Fahrenheit or 38 degree Celsius and 102.2 degree Fahrenheit or 39 degree Celsius. Tiredness. During infection, your body goes into fight or flight mode, a stressful state of the body. So the body needs to release an excess of stress hormone called cortisol or adrenaline. It takes a toll on your body's resources, thus you feel exhausted or tired with just little work. Impaired smell and taste. Reduced sensation to smell and taste can be the earliest sign of the COVID-19 infection. The infection of the nostril cavity causes inflammation of the mucosal tissue surrounding the cranial nerves responsible for sensing smell. There is a close link between the sense of taste and smell. The sense of smell can indirectly affect the sense of taste. Stage 2 infection with moderate symptoms. Balanced 20% of the people may advance to the next stage to lower respiratory infection with moderate symptoms. The virus propagates and migrates down the respiratory tract along the upper airway and conducting airway. At this stage, moderate symptoms are aches and pains, head, muscles and the body, chill feeling, gastrointestinal problems, and skin rash or discoloration of the fingers or toes. People with these symptoms require hospitalization with prompt symptomatic treatment. Body aches. A viral infection causes inflammation, especially in the throat, chest and lungs, which can be painful. The rest of the body might also ache because the body is working hard to fight off the infection. Also, due to nasal congestion, you cannot breathe as usual. So your body might not be able to get enough oxygen it needs to keep your red blood cells and tissues healthy. It can lead to aches and pains all over or anywhere in the body. Feeling chills. Chills refers to feeling of being cold without any apparent cause. The human body may use chills to boost its core temperature that might help the immune system to destroy the virus. Chills are a common symptom of infection which causes shivering or shaking. If fever occurs alongside chills, then it indicates the body is fighting off the disease. Gastrointestinal problem. In 29 studies of 6,064 cases reported gastrointestinal symptoms in patients with COVID-19. The prevalence of digestive system among them was 15%. In the reported cases of digestive symptoms, the patient complaining about lack of appetite was 79%, diarrhea 34%, vomiting 4%, and abdominal pain 2%. Around 10% of the patients presented with gastrointestinal symptoms did not have respiratory symptoms. The patients with gastrointestinal symptoms can be due to virus infection in the intestinal tract, may be due to their low stomach acid. Those with digestive symptoms have a positive stool test for coronavirus, which indicates they had SARS CoV-2 RNA in their poop. Also, patients with digestive symptoms took longer to clear the virus from their bodies compared to others. Skin rash and COVID toes. Discoloration of fingers or toes, also called COVID toes. In one report, COVID-19 patients in an Italian hospital found 1 in 5, that is 20%, had some sort of skin symptoms. It may be due to an inflammation in the circulatory system triggered by the infection or toxins from the virus. COVID toes caused by a small clog or microclot in the blood vessels, possibly due to skin reaction. If you have this symptom, don't rush to the emergency room, but don't ignore it either. The best thing to do is to contact your doctor or dermatologist. Stage 3 infection with severe symptoms. Unfortunately, about 5% of the people may progress to stage 3 with severe symptoms. At this stage, infection reaches multiple organs with severe symptoms. They are confusion, trouble breathing, persistent pain or pressure on the chest, blue lips or face, and loss of speech or movement. Confusion. Confusion is the inability to think clearly or quickly as usual. Also has disoriented and challenging to pay attention, remembering and making decisions. Confusion may be due to infection and low oxygen levels. Without oxygen, the brain cannot be able to work correctly. Trouble breathing. When you have shortness of breath or unable to hold the breath, dyspnea, you feel out of breath, tightness in the chest, hungry for air and unable to breathe deeply. Causes of shortness of breath may be due to inflammation, liquid accumulation or swelling in the airway, lungs, heart or blood vessels. The heart and lungs are transporting oxygen to the tissue and removing carbon dioxide from it. If there are any problem with either of these, affect the breath. People with acute respiratory distress syndrome (ARDS) often are unable to breathe on their own without a support from a ventilator. Chest pressure. Chest pressure is a sensation of squeezing, tightening, crushing, pressing like a tight band or something heavy around the chest area, with or without pain. Chest pressure with pain radiates to the back, may caused by dryness or inflammation in the sac that surrounds the lungs. It is an emergency symptom, so you should contact your doctor if you experience persistent chest pressure. The chest pressure is also a common symptom of heartburn or gastroesophageal reflux disease (GERD). So try to distinguish these two. Heartburn develops mostly after food and it goes away after a few minutes, whereas chest pressure is long-standing without any apparent cause. Blue lips. The symptom of blue lip means the typical red-colored lips turn into bluish tint or color. Generally, this is due to severe lack of oxygen in the blood. Slowly, this blue coloration progresses to the skin, especially hands and feet. It is an emergency symptom, so you should contact your doctor immediately. Loss of speech or movement. The brain and nervous system control the muscles used for speech. Damage to it leads to loss of speech or movement. It can occur due to inflammatory condition caused by infection. Call emergency medical service if you or your loved ones have any of these symptoms. Why stage 3 infection develop complications? In stage 3 infection, the vigorous immune response causes more harm than good. That is, immune response causes severe inflammation of various organs. A case report of Wuhan from 99 Covid-19 patients confirms that there is an increase in inflammation markers such as neutrophils, interleukin-6, IL-6 and C-reactive protein by about 38%, 52% and 86% respectively, and 35% decrease of total lymphocytes. Reference Lancet 2020 395. Why some individuals have a severe illness? The spike-like protein on the surface of the SARS CoV-2 virus bind to the ACE2 receptor in the body cell. ACE2 is present in the lungs, heart, blood vessels, kidney, liver and gastrointestinal tract. After attachment with the body cells, the genes of the virus RNA entered the cell and forced it to produce and release copies of the virus, which in turn infect more cells. Some evidence suggests that ACE2 may be higher in patients with hypertension, diabetes and coronary heart disease. That is, more receptors available for the viruses to bind and multiply. It may be a reason why those with underlying medical problems like diabetes, high blood pressure, heart and lungs problems or cancer are at higher risk of developing severe illness. That's all from today's episode. I hope I have provided a comprehensive list of COVID-19 symptoms. If I missed any, please share it as a comment that will be useful for other visitors. My humble request to all, please like and share this video as much as possible. It motivates me to make more informative videos for you. I request you to share your thoughts and questions as a comment. I will read every comment and answer your questions or take your suggestions. Thank you for watching this video and I will meet you soon with another useful video. Until then, goodbye.